Hello and welcome to this first video in a video series around postural management. My name's Richard and I'm the Clinical Training Manager for Jiraffe and for Jenks. So first of all, let's just take a look at the video series itself, at what it's going to include, who it's really for, and what we hope you get out of the series. So really this is an introduction to postural management, and it's aimed at anybody that's involved in the care of somebody with disabilities. So that might be a healthcare professional, a physiotherapist, an occupational therapist, a nurse. But it's also relevant for carers and families of those who've got disabilities as well. So no matter kind of where your knowledge is, whether it's the kind of first time you've heard of postural management or if you've already got quite a strong knowledge around the subject, there should be something in this series for you. We're going to take a look into the importance of 24-hour postural management as well, and why that has to happen over a complete day, 7 days a week. We're going to take a look at what actually impacts our posture, okay, and the risks associated with that and secondary complications, especially for those with complex disabilities. Then we're going to take a look at how to build a stable posture in seating, in standing and in lying. We'll take a look at the fundamentals of assessing for posture. So I hope that you gain quite a lot of useful hints and tips and some techniques around how to actually assess someone's posture. And then we're going to take a look at choosing the correct piece of equipment for the specific user as well. So there's a lot of equipment out there, so it's really important that we find the right piece for that individual. So without further ado, today's video is an introduction to postural management, and what we hope you'll gain from this is basically an understanding of what postural management is. We're also going to look at how to achieve a good position in sitting, standing and lying, and what are the factors around that and what we need to consider. We're also going to take a look at the kind of the negative side of what happens if we don't manage someone's posture as well. And then we're going to look a little bit more specifically around why that has to happen over a 24-hour period. Okie dokie. So when we think of posture, the first thing that we all do is kind of sit up straight in our chairs and try to be kind of as aligned as possible, because someone said the word posture and now we have to have good posture. So there's a couple of different ways of thinking about it. On your screen now you've got a couple of quotes from different practitioners. Really, to put it into a nutshell, posture is how the body fights against gravity to kind of remain aligned and in a position. You can see there the second quote from Pauline Pope goes into a little bit more detail and looking at how the body kind of conforms to the supporting surface, how we offload our kind of body onto different into different segments, and also how forces can impact our body internally and externally. So now that we've got kind of a brief idea of what posture is, that it's just us fighting against gravity to stay in a seated position or a lying position or a standing position, what's postural management? So it can be summed up as the approach of managing someone's posture, movement and function for those people that can't do it for themselves, and that has to be done over a 24-hour period, 7 days a week. We'll go into a little bit more detail of why that has to happen constantly a little bit later on in this presentation. So who is it that needs postural management? So myself and probably you, if you're watching this video, you may be able to adjust your own position. So if we become uncomfortable, if we're either lying in bed and we kind of get a numb shoulder, we can just roll over and that disperses some of the pressure onto different body segments. People with complex disabilities aren't always able to do that, so there's a lot of risks associated with that. So people that aren't able to adjust their own position are quite at risk of a lot of secondary complications, which we'll again go into further details a bit later on. So people also that have quite asymmetric positions, so perhaps they've got some deformities in their skeleton, which create more boniest points, which in turn creates more kind of pressure going through those bony points. And this can have knock-on effects around kind of skin integrity issues. They may have thermoregulation issues and also communication issues, so they're not able to actually advise when they're uncomfortable or in a lot of pain in a certain position. Another group of people that we need to manage the posture of are children and adults with abnormal tone. So someone perhaps with spastic cerebral palsy that goes into hyperextension that can bring them out of alignment, and they need to be kind of managed back into a nice neutral position. One thing to note at this point is that we do need to be careful when we are thinking about posture around anything that might impede someone's independence or function. So it would be, fantastic if we could give everyone, for example, a sleep system. But if that sleep system's going to take away their ability to roll themselves, if they've kind of have a routine where they do that, then we need to think about that and make sure that the interventions that we're putting into place don't stop someone becoming from being independent. So really, when we think of postural management, we think of helping people to have multiple positions. So this is usually within a sitting, a lying, or a standing position. But there's many therapeutic positions that we can have within a robust postural management plan. High kneeling, for example, to kind of stretch out hamstrings, etc. We also need to be aware that we want to offer as much active movement as possible. So especially with young children that are still developing muscles and developing motor skills, we want to encourage that active movement. And also by having these multiple positions, we're able to also offer more functionality and more independence. For example, in a seated position, it might be easier for that person to kind of communicate with their peers. So we need to take all of that into consideration when we're creating a robust postural management plan. So in terms of postural management, there are kind of three main aims to postural management. There are a multitude of benefits, which we can also go into a little bit later, but they can all be encapsulated into kind of three different areas. So the first one is around function. So that, again, we've spoke about this already, about allowing that child or adult to be as independent as possible. So again, we'll go into what that can include a little bit later on. We're also looking to minimise damage. So there's a lot of risks of musculoskeletal damage or internal organs being harmed if we're in a very poor posture. And the third one is around reducing energy expenditure. So especially in paediatrics, it might sound a little bit counterintuitive, but if I kind of pose a situation of maybe a child that struggles to keep themselves up in a chair and spends the day using a lot of energy just to kind of keep themselves up in a good position in the chair, because they've spent all of that energy throughout the day just trying to find a functional position, they're not able to engage in kind of classroom activities or any therapeutic program. So really it's about conserving that energy and being able to be more functional in the time that you actually need to be more functional. So when we talk about function, what kind of things are we thinking of? So firstly, all of our bodily systems, so breathing, digestion, eating, for example, so all of our kind of activities of daily living. Communication is a really big one. A lot of the people that we help are non-verbal, so they rely a lot on eyesight for their communication skills. If, for example, that person is not in a very good posture, if possibly they might be a little bit slumped forward and a bit kyphotic at the top of the spine, perhaps they don't have very good head control, so they can't keep their head up. So if that's the kind of position that person is adopting throughout the day, it means that a lot of their time is spent looking at the knees and not being able to maintain eye contact. So it really will remove that person from the world, and we're really looking to offer as much engagement, independence and happiness as possible. And obviously play as well, especially for kind of our young people that we look after. There's a lot of development that can happen within play around motor skills, communication skills, social skills. So it's a really important part of a child's day. So when we think of minimising damage as the kind of section of postural management, this can include a lot of different things. So we might be looking to prevent or minimise any deformities happening within the skeleton, also with any soft tissues adapting over time. Also, if we adopt very poor postures, it can cause compression of the internal organs. So, for example, if we're quite slumped forward, it has an impact on our rib cage and we're not able to breathe as well. Formation of contractures is quite a prevalent one that we see a lot. You've probably heard of the term a person becoming chair-shaped, and that's really when someone's adopted a seated position for the majority of the day for a long period of time, and all those soft tissues, tendons and ligaments, they've all fixed themselves at a kind of 90 degree angle. So we've lost a lot of range of motion there, which can happen. So it's another reason why having a robust postural management program that includes a lot of different positions helps to really prevent those contractures from happening. So that really also includes kind of shortening and over lengthening of muscles and tendons, again in that situation where someone's been in a seated position for too long and they've their tendons have become too short and they're not able to gain that range of motion. But also what I like to think of in this instance is maybe a wind sweeping position, which you may have heard before. And that's where if someone is lying down with both legs folded over to one side, the leg on top almost has got the muscles and the tendons on the outer side of the leg have become too long, and the ones on the inside of the leg have become too short, and then the exact opposite on the kind of bottom leg. So what happens there is if that has been over a long period of time, those muscles and tendons may have actually fixed in that position, which then means you're not able to come into a nice neutral position. So really, if that happens, it's going to be much more difficult to find a comfortable and pain-free seated position. And really what that's to do with is the elasticity and plasticity of our muscles. So if you think of perhaps a piece of blue tack maybe, if you pull that blue tack apart, and then you kind of release at a certain point, it will regain its shape just naturally. If you overstretch it and it goes past the point of kind of no return almost, and it isn't able to regain its original shape, that's kind of the idea of plasticity. So if that happens to me or you, maybe we've had a sports injury and we kind of overstretched a tendon, it will take time, but we'll be able to heal and hopefully regain that range of motion. The studies around this with people with neurological conditions suggests that they're not able to regain and retrieve that muscle plasticity. So once it's unfortunately gone past that point of no return, they're not able to regain it. So it's quite an important thing to think of from an early intervention point of view, that we're really looking to kind of stop that from happening or minimise the chance of that happening. Now, we've already kind of spoke about a few scenarios around reducing effort and energy output. We spoke about having to have enough energy to be functional, and if all of our day is just spent exerting our energy just maintaining a neutral posture, then it's not efficient, and it's going to limit how independent we can be. So if you take, for example, somebody that can self-transfer themselves onto a toilet, again, if they've used all that energy up just sitting, they might lose that ability to do that transfer. The other thing to think of in this respect as well is also that idea of management over treatment. So if we manage someone's posture effectively and from a very early age, the likelihood of them having to have any kind of operation or surgery to correct anything is lower. But if they still need to have maybe a hamstring lengthening surgery, then we need to think of how that's going to be managed before and after that surgery, because the treatment won't be as successful if we don't manage the positions. I hope that made sense. So In terms of what is beneficial from a postural management point of view, all of our internal systems, organs, they'll benefit greatly. So we've already spoke about the kind of respiratory side of things, so being able to open that chest cavity up and allow the lungs to function as best as possible. Again, if we're in that hunched over position, that really puts a lot of pressure on our kind of digestive system and our bowels and our bladder, and the likelihood of becoming kind of constipated or impacted is increased as well. And how that then affects everything else, it has quite a knock-on effect, and just terms of mood, also general health, that sort of thing. Being also in different positions, in a standing position, our heart has to work a bit differently and a bit harder to get blood all around of our body, so it's good for the cardiovascular system. And in terms of skeletal health as well, if we think of perhaps the hip joints of children before the acetabulum, which is your hip socket, is formed, it's actually quite flat. So it's the process of being in an upright position and loading over that pelvis, which actually creates that natural acetabulum groove that we have as kind of adults. So if that isn't happening at a young age, if we're not in a standing position, if we're not bearing weight through our pelvis and our hips, then that it's going to be more likely that acetabulum isn't going to form as well. So the evidence does suggest that as soon as we can get children standing, it leads to better outcomes. So there was some examples of kind of the physical side of things and how it actually benefits our kind of internal organs and our bodily systems. But in terms of kind of the social, psychological well-being, we've already spoke about communication, how important that is, and being able to have eye contact and be engaged within a room. Engagement is a massive one, especially for kind of children in their development. If we're not able to be on kind of the same peer height, we're not able to interact with our peers, we're not able to progress as quickly or be involved with classroom activities. It kind of segments, or it can segment you away from that. Happiness in general, and being happy and being included, being in different positions, getting a different perspective on the world as well has shown great results in terms of having that kind of spatial awareness and body awareness. So adopting different positions like a standing position is going to help with things like that. And you might be thinking, why are meerkats there? We don't turn into meerkats, unfortunately. That was to show alertness. So being more alert, being more aware of our surroundings. So especially when we were talking about that reducing energy, it's allowing us to have that kind of energy to be more alert and to get involved and to be more engaged in the activities and the functions that we want to do in the day. Just a few other things to kind of point out around the benefits and what we're really looking to achieve. One of the main things is obviously as living as pain-free as possible and reducing any discomfort. So there's a load of gold standards around postural management of what we look to achieve, which is great, and we should always aim to kind of achieve those gold standards. However, there does need to be an aspect of comfort involved with that as well, because if you're kind of being made to sit in a position that isn't too comfortable for you, then in terms of how long you want to tolerate that, it's going to affect things like that. So it's just one thing to be aware of, that although we want to do our best and look for our optimal points of our optimal joint ranges, that in certain circumstances we need to take other things into consideration as well. We've already mentioned things around early interventions and better outcomes. I mentioned before about there's quite a few standing studies that suggests standing children from around the age of 12 months will hopefully bring better outcomes. Adopting more happy and healthier life, feeling more engaged. We've already kind of mentioned that in the last slide. Being more functional and independent. We want to promote that as much as possible for our young people and adults. And also just another thing to consider would be the cost to here in the UK, the NHS and medical providers around the globe. It's not something that I tend to focus on much, to be honest, but if we think of things like hip corrective surgeries that has to happen in the UK, that does cost the NHS millions, whereas a robust postural management plan from a young age would cost significantly less than that. So now let's take a look at what impacts our posture. So the main thing that impacts our posture, both internally and externally, is forces. So in case you need a little bit of a reminder, if you haven't done physics since GCSE, like myself, a force is basically something that has magnitude, or a size. It has a direction and a point of application. And what a force does is simply it moves something, or it stops something from moving, and it can also change something's shape. So if we think about that in context of our bodies, that's happening constantly inside of us, in the kind of internal side of things, but also we've already spoke about things that are happening externally to us as well. So one of which is gravity. So we've spoke about posture being basically ourselves trying to keep aligned against the constant struggle of gravity. And this slide here just depicts the human sandwich of basically gravity trying to compress us into the supporting surface. So not only do we have gravity on the outside affecting our posture, but there's a lot of things going on internally. So one of the forces that we're subject to is compression and tensile forces. So one example of this would be perhaps your bicep muscle. So when we kind of go into extension and flexion, that's the bicep muscle compressing and also stretching out into tension. Another couple of things to bear in mind, especially when we think of posture and seating, one would be shear forces. So that's basically where, if we think of a seating situation where the person's sat on the supporting surface, and their skin is kind of moving forward, their body weight is pushing them forward, but the supporting surface is causing the skin closest to it to stay where it is. So there's a lot of skin integrity issues and tears and kind of pressure that can build up over time through those shear forces. Another one that's quite similar to shear force is also friction. So that's happening all of the time. It's where two surfaces are rubbing together. So you can kind of think of that if a person's in a piece of equipment and maybe their clothing is rubbing against their skin, it can cause abrasions, that sort of thing. So buckling, you've got the picture here of a 30 centimetre ruler. So I think that's a really good depiction of buckling, because you can pop quite a bit of pressure through the ruler, and it takes quite a while before it to actually start bending. You can apply quite a bit of force, but once that kind of bend's happened in the ruler, it's actually really quite easy to bend the ruler more. So I like to think of that as the human spine, really. So if by applying pressure to the top of the head through gravity, over time, if that's not managed, the spine can become curved. So you're kind of in a kyphotic posture. Now, what's happened once that has kind of started, the head becomes a little bit further away from the body, and therefore the forces that are going through the head becomes more powerful. So it's actually easier for that curve to get worse. So if we don't manage someone's posture and they have a bit of a kyphosis, it's likely that could get worse through buckling. Then we have rotation. So again, that's happening throughout the body. We like to twist and turn to see our environment. Again, you can imagine the spine doing that and all the vertebrae. Now that's not a problem. We need to be able to do that to engage with our surroundings. However, if we're constantly in that rotated state, time under tension can cause quite a lot of issues. So those are things just to think of when we think internally of the body, of what's going on, and how that kind of impacts someone that can't change their position. So when we look at the human body itself, some of the kind of key notable things are that the body's naturally unstable and it's very flexible. So we aren't kind of conducive to having a stable posture. We're quite long, we're quite tall, we don't particularly have a wide base of support. So luckily for most of us, we've got a lot of internal stabilising mechanisms that help us to balance, like our vestibular system and our inner ear. A lot of people with complex disabilities and neurodisabilities they don't necessarily have these bodily functions, or they might be impaired. So that's where external supports might come into play a bit more, because they're not able to keep their balance, and there's a lot more slumping and a lot of more unstable postures to consider. We're also quite vulnerable to damage as well. There's a lot of soft tissues. We can kind of break our bones quite easily, and all of that kind of internal compression that we've spoke about earlier on as well. We're quite susceptible to those things happening. For us day to day, we can kind of come across sports injuries and things like that, but if we think of a person that can't manage their own posture, if they're not able to adjust their position, we have to think of things like pressure issues. So the skeleton kind of piercing the skin through an internal function of gravity, applying pressure to the skeleton, and not being able to shift that body weight from side to side may allow kind of pressure to build up in certain areas. We've also spoke about soft tissues adapting over time. So we mentioned the idea of becoming chair-shaped. So if I adopted a seated position for a very long period of time, if I'm kind of in this seated position for years almost, over that time, soft tissues do kind of adapt to that shape. So I like to think of it as in kind of silly putty. So if you put silly putty over an object, over time that silly putty would develop that shape and then kind of envelop that object. The same thing happens with our bodies. So it's one of the key reasons why we have to adjust our posture. So as just a bit of a recap of the things that could happen if we didn't manage someone's posture that needed to be managed. We've spoke about the formation of contractures already. We've got the possibility of deformation of the skeleton. So if we adopt a poor position for a long enough period of time, we can adopt that shape, and our bones will become fused into that shape. So if we think of a fixed kyphosis, where we've got that kind of hunch in the top part of the spine. We spoke about the compression of internal organs and the knock-on effect to that, and the secondary complications that can occur from that. It's going to be harder for your bodies to work and to function, but also for example, if we take the idea of a peg site and being fed through that peg site, if we're not in a conducive posture for that, it's going to be harder for your body to absorb those nutrients, and it's going to be harder for the body to accept those nutrients as well. We briefly spoke about pressure-related injuries, so pressure sores, and if we basically stay in the same posture for a long period of time, we've got different bony points in our body. So if, for example, we were in a supine position, if we were laid down on our back, one of the boniest points is at the back of our heads, and what a pressure-related injury is really, the way that I like to think of it, or I don't like to think of it, but the way that my brain works is it's basically the skeleton trying to leave the body. So the gravity is creating enough pressure for our skeleton to actually start to pierce the internal soft tissues of our body and through kind of the different layers of skin. Especially with those boniest points that we've got, like on the back of our head, on our heels, the sacral bones of our pelvis, things like that. And you could start to see pressure-related injuries from lack of adopting different postures. So, and then we also have the issues around osteoporosis and osteopenia, where the bones become too brittle because we're not weight bearing through them as well. So obviously that can happen for anyone, and it's more prevalent in the kind of older adult community. And then all of these things can lead to certain infections as well, and if the body isn't functioning as well, it's not going to be able to fight off those infections as well as it could. So this next slide here, we have a gentleman that's clearly not had a great deal of postural management in his life. And I like to show this slide in a lot of my presentations just because it really kind of depicts what possibly could happen. Obviously, I've never met this gentleman. I don't know what his diagnosis is, or if any of his issues are fixed or flexible. But I think it's safe to kind of assume some things. So, for example, if we take a look at his ankles and his feet, they're in quite a plantar flex position, which means that your toes are kind of pointing towards the ground. It's quite likely that that might be a fixed position, so he's not able to get that 90 degrees at the ankle. And what that might mean is it's going to be very difficult for this gentleman to be in a standing position, because all of the pressure and all of his weight will be going through his toes. And also it's not going to create a very stable base if you're just balancing on your toes, for example. Also, though, in a seated position, again, we like to sit with our feet at plantigrade or 90 degrees. It's also going to be very difficult for him to sit comfortably from his feet point of view. And if you work up his kind of lower limbs, we can then see that his knees are quite flexed. Again, we don't know if this is fixed or if it's flexible, but if it is fixed, it looks at quite kind of a 45-degree angle, which is going to be very difficult again to seat this gentleman, as his legs are going to go basically going to be behind his bottom if he was in a seated position. And then you can see that again his hips look quite flexed as well, so it's the same kind of issues there. His chest, and if you look at his chest in comparison to his pelvis, there appears to be quite a lot of rotation happening in that spine, and it's quite likely that there's going to be some issues around kind of rib flares and things like that, which is where one of the ribs might be protruding a little bit, which is, it's not going to be comfortable, especially if you're lying on that protrusion, or and also it might impact his breathing. The other thing to note with this gentleman is what I was mentioning before around that wind sweeping issue. So you can see that both of his legs are over to one side, and again it's likely that those soft tissues and tendons have all kind of been overstretched on one side and shortened on the other. So when we are wanting to get into a seated position, which we'll go through on another video, we like to sit in a little bit of abduction to create a stable base. That's not going to be very easy to create with this windswept position. So really, it's this slide is just to kind of highlight certain things that could happen. Obviously, I think this gentleman probably was born a little bit before the concept of postural management happened. But now that we know what we know, it's likely that we can implement things and help people in the same situation not have the same outcome. And finally, I just want to talk about why it has to happen over 24 hours. I think probably from what we've gone through in today's video, it's quite apparent why. First of all, gravity is constant. It doesn't take a break. So we're not able to take a break from gravity. So it's constantly bearing down on us. So we need to manage our positions constantly. Also, when we think of what can happen from an unmanaged posture, like in the slide that we've just seen, the idea of being able to lie in a good position so that we're able to then sit. So the way that I like to think of it is we need to lie well to sit well. So if we've managed those kind of issues, any rotations, any wind sweeping from an early age, and we're in a nice aligned position when we're sleeping, that's going to allow us to be more functional in a seated position as well. The other thing to consider is the fact that on a good day, we may sleep for around 8 hours. That's a long time to be in one position. We've got lots of different options in the day. We can go in a standing frame for an hour. We can have different kind of seating systems, or if possibly kind of different walking aids if possible. But a big chunk of those 24 hours is in bed in an aligned position. So it's one of the key things that we need to think of when creating a robust postural management plan, because standing in a standing frame for an hour in the day is great and has got a lot of therapeutic benefits, but a lot of that good work can be kind of undone in the other 23 hours if we're not kind of on top of it. Also, to obviously meet those 3 aims of postural management, which which is also very important. So when we talk of function, being in those different positions is going to allow us to be more functional and more independent for different tasks. It's also going to help us to reduce all of that fatigue as well, so that we're able to be more functional, and obviously to minimise that damage to the body that can happen through unmanaged postures. Also, soft tissue adaptation. I gave you an example before about that kind of silly putty and our lower half becoming that silly putty if we just stay in one position for too long. The pressure areas, again, we've kind of spoke about that and why that's so important. And also all the kind of psychosocial benefits as well of being included and having a different perspective on the world. Standing up, it gives you a complete different view of a room than sitting down, so it's important to have those different perspectives and gain that spatial awareness of how our bodies interact with the environment. So if we summarise today's key learnings and what we really hope you take away from this video, first of all, posture. So what is posture? Constant struggle against gravity. So it's our bodies trying to stay aligned against gravity in the most kind of simplest way of thinking of things. What's postural management? It's the management of someone's posture who can't do it for themselves, and that's over a 24-hour period. What are the three main aims of postural management? So function or independence, allowing someone to do as much for themselves as possible. Number 2 is minimize damage, so stopping those skeletal or muscular damages or internal organs that get damaged from poor posture. Number 3 is to reduce effort or fatigue, so to allow us to be more functional, we need to conserve energy throughout the day. We've spoke already about the benefits of postural management over a 24-hour period, and we've also spoke about the negative outcomes of what can happen to a person if we don't intervene. Okay, so I hope that was useful, and wherever your kind of knowledge has been, that you will have hopefully gained something from there. The next video that's going to be on the anatomy and biomechanics. So we're going to take a look at some of those issues that we've mentioned today around any kind of asymmetries of the skeleton, any kind of muscular issues, and basically how the body moves and how it segments itself. So that will be the next video. So I hope that will come out for you guys very soon. So yes, thank you very much for your time. I hope you found this useful, and I look forward to doing the next one. Thank you.